What's up everyone, it's Hunter here, back with another video. For those of you that are new here, I'm a second-year DO student. I recently got married, and while I was on my honeymoon, I saw that Kevin Jubbal, MD, who many of you know from the Medical School Insiders channel, it's just Med School Insiders, dropped a video, and this video is called MD vs. DO, The Uncomfortable Truth, and Which is Better. So I wanted to watch it, but then I was like, wait, I should react to this as a DO student. So I'm going to record on my screen here and have my reaction to this video. Enjoy.
An MD is Coca-Cola and a DO is RC Cola. You understand? It's like an off-brand doctor.
There's a beef in the medical community, and no, I'm not talking about doctors versus med-levels like PAs and NPs.
I'm going to speed this up. If you want to watch the actual video, go find it and watch it, but I watch everything at double speed, and Kevin sounds silly at normal speed, so I'm going to speed him up.
Today, I'm talking about the beef between MDs and DOs. I've seen a lot of comments lately from both MDs and DOs taking digs at each other, so it's time to set the record straight. Let's talk about the similarities and differences between MDs and DOs and why there's so much tension between them. MD stands for...
So he says that there's a lot of tension between them, and I guess from my standpoint as a student, I don't know that there's much tension, so much as just like a superiority kind of argument between the two, but we'll see what he has to say.
Doctor of Medicine, and DO stands for Doctor of Osteopathic Medicine. Although their titles differ, there are more similarities than there are differences between the two. To start, both MDs and DOs are fully trained physicians and are qualified to treat patients. Both must earn a 4-year bachelor's degree and complete the same prerequisites prior to applying to medical school. Students applying to either type of program must take the MCAT and have solid extracurriculars, including volunteering, research, shadowing, and leadership experience, just to name a few. Both must complete 4 years of medical school, including 2 years of preclinical and 2 years of clinical, with rotations in a variety of specialties such as IM, OB/GYN, Peds, FM, surgery, psychiatry, etc. Both must also pass licensing examinations, followed by 3 to 7 years of residency before they're able to practice independently as a physician. And as of 2020, the residency programs for MDs and DOs have merged, so both are applying to the same programs. MDs and DOs can practice any specialty within medicine in any state, and both use the same evidence-based approach when treating patients.
So far, everything that he said is true. There are more similarities than differences. As of the most recent years even, everyone's going into the same residency match process, so there's fewer and fewer things that separate MDs from DOs, but we'll continue to see what he has to say.
There's no difference in the scope of practice between an MD and a DO, so outside of the letters on their badges, you are unlikely to notice a difference between the two in the clinical setting. Now, with that out of the way, let's get into the differences. The primary difference between MDs and DOs is that MDs attend allopathic medical school and DOs attend osteopathic medical school. Although the curricula between the two types of schools are very similar, DO students must complete an additional 300 to 500 hours of training in osteopathic manipulative medicine, or OMM for short. Some students consider this the tax of attending osteopathic medical school.
This is what all of my friends and I say, so he's exactly right. The curriculum at an MD school and a DO school are almost exactly the same. A DO takes every class that an MD takes, but we do take OMM, or osteopathic manipulative medicine, which we call our tax for not getting into an MD school, but that doesn't mean that DO schools are inferior. It's just how we feel, and we might get into that later.
School. The licensing exams between MD and DO students differ as well. DO students take the Comprehensive Osteopathic Medical Licensing Examination, or COMLEX, whereas MD students take the United States Medical Licensing Examination, or USMLE. Both the COMLEX and USMLE are designed to assess competency and are composed of 3 levels or steps designed to test a student's medical knowledge at different points in their training. That being said, some DO students opt to take the USMLE step exams in addition to the COMLEX to increase their competitiveness for residency. The 2 sets of tests are...
So that is actually true, and I would say true of more students than not, especially now that the whole residency match process is one merged thing between MD and DO schools. It takes more to be a competitive applicant as a DO student when compared to MD counterparts. So a lot of us, especially those that want to go into a competitive specialty, will end up taking both sets of board exams. So that's 2 8-hour exams, usually within 1 week of each other, on multiple occasions.
Are very similar and assess students on similar knowledge. However, the consensus among students who have taken both exams seems to be that the COMLEX is not nearly as difficult as USMLE. Many report that the questions asked on the COMLEX are conceptually easier, but are also poorly written and confusing compared to the USMLE step questions. One student on Reddit compared USMLE's questions to a nice, well-prepared and researched novel, and COMLEX's questions to a novel that was, quote, put in Google Translate back and forth 50 times. These are anecdotal experiences, however, so take them with a grain of salt. I know
We will be taking boards at the end of this year, so I don't know the truth behind that. I've only started taking COMLEX style questions in this last week, and we'll start to take both USMLE and COMLEX style questions in the coming months as I start to prepare for those boards. But what I did learn today is that when describing the tests, people usually say that although both passages are long, the COMLEX passages in the questions are usually very vague, and there are only ever 4 to 5 answer choices, where on USMLE you can have anywhere from 4 to 20 answer choices on some questions.
Another difference between MDs and DOs is their ability to practice internationally. The designation of MD is more widely recognized across the world, so US-trained MDs can practice medicine in most other countries. The title of DO is less common across the world, and therefore DOs are not able to practice in as many countries as MDs. That being said, DOs have practice rights in approximately 50 countries, with the American Osteopathic Association, or AOA, working diligently to increase acceptance of DO degrees by more and more countries. MDs and DOs also...
This is a very interesting fact that I didn't know. I never really considered practicing medicine abroad, so it's interesting to learn that that's kind of a door that's more closed than open as a DO compared to an MD.
Also differ in their options for residency. In the past, DO and MD students used to participate in separate matches. However, as of 2020, they now participate in the same match process. Now, that being said, many residency programs, especially the more competitive ones, still have unspoken preferences for MD students over DO students. If you're a DO student, it can be incredibly challenging to match into something like plastics or dermatology. For instance, the year that I applied to plastic surgery, there was only one osteopathic med student who also matched into plastics, and it was considered a big deal because it just doesn't happen often. This is a really important factor for pre-meds to consider when they're applying to medical school, and most advisors don't even know about this. You can actually watch my video on medical advisors right up here on the Medical Insiders channel. Now, you might be saying, hey,
So now that's an interesting point, because this merger that we've been talking about, there was the AOA and then the ACGME. ACGME is typically MD residencies, and like he said, a lot of those, especially competitive programs, still have a preference for MD students. And it's also true of the AOA residencies. They still have more of a preference for DO students. Now, the merger was supposed to make it easier for DO students to compete with MD students and kind of just give access to all these residency positions to everyone who's getting medical education. But it's still just as competitive to get into plastics and derm and ortho as it was before. And now, with both of our board exams being pass-fail, we just have to go one step farther, which is why we have this like tax, because it's just known that if you come from a DO background, it's harder to get into those competitive specialties.
I don't want to go into something competitive, so who cares whether I go MD or DO?
According to the AAMC, as much as 70% of medical students change their mind about their specialty during medical school. And I was actually one of those students. I went into medical school thinking that I was going to do pediatric gastroenterology, but ended up switching to plastics instead, which of course is substantially more competitive. Had I gone to osteopathic medical school, I would have had an incredibly difficult time matching into plastics. That being said, there will always be outliers that still match into competitive residency programs as DOs, like that one student from the year that I went into plastics. But keep in mind, these are the exception, not the rule. And just because your grandfather's twins, cousins, uncles, dogs, vacuum cleaner's nephew got into dermatology or plastic surgery as a DO, that doesn't mean it's the same as applying as an MD. This actually reminds me of how a pre-med advisor once told me that when a pre-med is considering MD versus DO and they aren't sure, the advisor, I kid you not, they pull up findado.com and they look up to see if there are any DOs in that specialty. Spoiler alert, there are DOs in every specialty, but there are far fewer in the more competitive specialties. They're more skewed towards primary care. I literally do not have enough hands to face palm hard enough for such world-class incompetence, because not only does that not demonstrate any factual data about the likelihood of matching to a certain specialty by going MD versus DO, but it also ignores the fact that greater than 50% of pre-meds will not even apply to their intended specialty by the end of medical school. But most frustratingly of all, this is incredibly damaging and harmful to the pre-meds. We can see this pattern in the types of specialties that MDs and DOs gravitate to as well, as most MDs specialize, whereas most DOs practice in primary care specialties. According to the AOA, nearly 57% of DOs practice in primary care specialties. We have 31.4% who are family physicians or general practice, 10.6% are internists, and 6.9% are pediatricians. If we compare this to AAMC data for MDs, less than 30% of active MDs practice primary care specialties. We have 11.3% in family medicine or general practice, 10.6% who are internists, and 6.8% who are pediatricians. Next up is compensation.
Now, that is absolutely true, everything that he just said about primary care versus specialization. But my school in particular, Des Moines University, we had a lot of people go into fairly competitive specialties in this last year's residency match. So with this merger and boards going pass-fail, I'm interested to see how things change over the coming years, and by the time that I start applying to residency. Who knows, it might skew a little more into DOs specializing more, but just from talking to a lot of my classmates, a lot of them are very passionate about primary care, and that's what they intend to do.
MD physicians tend to earn higher salaries than DO physicians. However, this is more likely a consequence of two things. Number one, MDs are specializing more, and they also practice in more urban areas, whereas DOs tend to specialize less and practice in more rural areas on average. So keep in mind that your choice of specialty is much more important in determining your level of compensation than the title of MD versus DO. Now that we know the similarities and differences between MDs and DOs, let's talk about why the conflict exists.
So the whole compensation thing, he's dead on. I think that if you have two physicians that are in the same practice doing the exact same thing, an MD versus a DO isn't going to change how much you're compensated, but where you specialize and what you decide to practice in will determine your pay.
Basis of the two occasionally butting heads is rooted in the stigma that DOs have been fighting to eliminate for decades. Osteopathic medicine was started in 1874 by Andrew Taylor Still, an American doctor. He coined this practice of medicine osteopathy, reasoning that the osteon, or bone subunit, was the primary originator of many pathological conditions. This theory ultimately gave rise to the practice of osteopathic manipulative medicine, or OMM for short. The fundamental idea behind OMM is that body manipulation can bring about systemic healing. This is a largely antiquated theory, with many osteopathic physicians actually moving away from these pre-scientific ideas. Although some of the OMM therapies have stood the test of time as we've transitioned to more evidence-based medicine, some of it is absurd quackery. Take craniosacral therapy, for instance. The thought is that light touches by the practitioner over certain bony prominences can alter the flow of cerebrospinal fluid. This is simply not backed by the scientific literature.
I thought my dopes were bad.
The other
And now I will say I haven't learned that specific technique yet, and as you learn them, they definitely can feel very weird. They don't make sense. And then there's some manipulations that we do that it's like, okay, that works, but I wouldn't necessarily use it instead of a different treatment. I would probably use it in conjunction with another treatment, but at the end of the day, I don't really plan to use it beyond med school, but to each their own. I mean, some people are absolutely planning to use it in their future practices, others don't. We all have to learn it. It's the tax.
main source of stigma between MDs and DOs is that DO schools are, on average, substantially less competitive to get into than MD schools. According to the American Association of Colleges of Osteopathic Medicine, or AACOM, during the 2020 to 2021 application cycle, there were approximately 27,000 applicants and about 8,500 matriculants, which is a matriculation rate of about 32%. If we compare this data from the AAMC, there were approximately 53,000 applicants and 22,000 matriculants during that same 2020 to 2021 application cycle, which is a matriculation rate of about 42%. Now, if we look at matriculation rates alone, it may seem like going into a DO school is more competitive than getting into an MD school. However, when you look at the average GPA and MCAT for matriculants, you'll see that this definitely is not the case. The average GPA and MCAT for DO matriculants in 2021 was 3.56 and 505 respectively, whereas for MD matriculants, it was 3.73 and 512 respectively. Now, those may just sound like numbers, so for perspective, a 505 on the MCAT is considered around a 62nd percentile score, whereas 512 is considered around the 84th percentile. Now, if you ask anyone who has taken the MCAT, they'll tell you how big of a difference those 7 points are. So because of this lower average GPA and MCAT for DO school matriculants, DO students are often perceived as less smart or inferior to MD students. Another common argument is that DO schools are of lower quality than MD schools, and therefore students don't.
This whole video sounds like he's just like ripping on DO schools. Like there's nothing wrong with going to a DO school. It is less competitive, but at the same time, it's getting more and more competitive as time goes on. I mean, if you look at the data over the last 5 years, those MCAT scores and GPAs have been going up. So just because you apply to a DO school instead of an MD school doesn't mean you're going to get in.
Receive as good of an education. This is obviously super dependent on the specific school that you're going to, but let's see if there's any data to back this claim. MD schools are accredited by the Liaison Committee on Medical Education, or LCME, whereas DO schools are accredited by the Commission on Osteopathic College Accreditation, or COCA. According to the LCME, there's only one MD school that is on probation that is not meeting standards. That would be California North State University School of Medicine. They will have to become compliant in 2 years or they'll lose accreditation. Now, in contrast, according to COCA, there are 8 DO schools granted accreditation with heightened monitoring status. This means they are non-compliant with 3 or fewer standards, and accreditation is granted for 4 years. Although the two accrediting organizations differ in their standards, 22% of DO schools are non-compliant with COCA standards, and only 0.6% of MD schools are non-compliant with LCME standards. As such, you are much more likely to run into issues with accreditation at a DO school compared to an MD school. In addition,
now, this is true, but again, it depends on how you look at it, because there are, when you apply to DO schools, you definitely want to be careful about which ones you accept a matriculation into, because there are 5 kind of like founding DO schools that are like really solid. If you go to one of those, you're not going to have any problems with your career at all. But there have been a lot of DO schools that have come up in the last like 5 to 10 years that are brand new and are working out the kinks of their programs, so they are on those heightened monitoring statuses with accreditation. Now, if you look at MD programs, there are a ton more in the country, and they've mostly been around for a lot longer time. So those percentages aren't super relevant.
MD and DO programs may also differ in terms of the quality of their clinical rotations. Many MD programs have been around for a long time, and they're associated with state universities and teaching hospitals. As such, they generally have more funding and long-standing relationships with hospitals. As a result, they're often able to offer greater access to clinical rotations in a variety of specialties. In contrast, many DO schools are newer, and they're often not associated with state universities or hospitals, so the quality and variety of electives may be lower. Now, obviously, it should be noted that this will vary from school to school. Newer MD schools may experience the same limitations as newer DO schools. In general, though, the consensus seems to be that MD programs will typically have higher quality rotations and also more access to those rotations in highly competitive specialties compared to DO programs. This is another reason why it's often easier to match into a competitive specialty as an MD as opposed to a DO. The prevalent
Now, I can only speak to my school on this fact, but it sounds from talking to upperclassmen that this is kind of the case. I mean, I don't know of any DO schools that are affiliated with a major hospital where all their students rotate. So at my school, all of the students get assigned a core rotation site for their third year where they will spend majority of their time doing their rotations, but not all of them necessarily stay here where we're doing our first 2 years. Everyone kind of splits up and goes across the country. I think 60% of the class stays in this general area. But because we don't have that large affiliated hospital, we don't have those connections to send everyone to rotations here. But it's kind of on you as a student to line up some of your rotations. If you want to do competitive specialties or see something specific, you have the autonomy to find a rotation to do with a physician that you want to do it with.
Of MDs versus DOs also plays into the stigma. Now, since its origins, the Doctor of Osteopathic Medicine degree has always been less common than the Doctor of Medicine degree. Today, approximately 90% of physicians are MDs, and only about 10% are DOs. There are also far more MD schools than DO schools in the US, with 155 MD and only 37 DO. Now, this is changing, however. Within the past decade, the number of DOs has increased by approximately 80%, and approximately 1 in 4 medical students are now DO students. That being said, many people outside of medicine still don't know what a DO is, and they're just much more familiar with MD. This is further exacerbated by the fact that there seems to be less transparency among DO physicians compared to MD physicians. If you look at doctor influencers...
Now, I don't know that I feel the same about that at all, because if you ask most people what a doctor's degree is, they're not going to tell you that it's an MD, and they don't really care. If you ask a general layperson if they want an MD or a DO, they don't know the difference and they don't care.
On social media, you usually don't see DOs owning their titles as much as MDs. Most MD influencers have their title in their name, whereas most of the DO influencers that I've seen, they don't. They just go by Dr. John Smith instead of saying John Smith DO. There could be a few reasons for this. One is that DOs know that their degree isn't nearly as recognizable, so they just do it to avoid confusion. Instead of having to repeatedly explain what a DO is, it's just easier to tell someone that you're a doctor and have them understand that you're a doctor. But there could be a second reason, because if that was the only reason, you'd likely see more people making videos to bring awareness to the DO profession. So the alternate theory is that due to the stigma surrounding DOs versus MDs, some may feel self-conscious about their title, and they don't want the public's misconception of DOs to impact their credibility as a physician. It's unfortunate, but a lot of the public, I mean, they fear what they don't know. So when the public hears that DOs are the RC Cola of doctors, it colors their perception because they're just not familiar with that title. In reality, we need more DOs to own their title and bring awareness to the fact that DOs are real physicians. They're real doctors too, unlike a lot of other influencers from other professions that deceive the audience into thinking that they are physicians. All right, next up, ego. Although these factors are likely where the stigma originated.
Yeah, I don't really follow a ton of medfluencers online. I mean, I've watched Kevin's videos since I was a pre-med before I graduated undergrad. So I can't speak to whether people use their titles in their names or not. But as long as I have a channel, I own that I'm a DO student right now, and when I become a physician, I will own it then. So we'll see how that changes in the next few years as well, as physicians in social media becomes more popular.
Ego on both sides is what has allowed it to persist. On the one hand, you have MDs who say DOs aren't as good because they have lower MCAT, lower GPA, a lot of OMM is not backed by scientific evidence, and their medical schools can be argued to be inferior. But on the other hand, you have a lot of DOs who also have their own ego, right? They say that, hey, I became a DO because I wanted to take care of patients holistically and not just push drugs like those allopathic MD doctors do.
Hey, I'll own it. I became a DO because I didn't get into an MD school, and so that's why I keep saying that it's our tax, OMM, is our tax for not getting into an MD school. I knew that I wanted to do a competitive specialty. I knew that doing it from a DO school would be more difficult, but I am still proud to become a physician as a DO, just as I would have been as an MD.
Say that MD doctors treat patients as diseases, whereas DOs are trained to treat them like people first. No.
And I would say that all of the philosophies that differentiate osteopathic medicine from allopathic medicine are very dated. Like, sure, what he just said is why osteopathic medicine was founded, but at the end of the day, you don't have allopathic physicians treating their patients based solely on their symptoms, not looking into the other factors of their life. And the same goes for DOs. Like they practice medicine in the same way. You just might have people who feel very strongly against the other that like to portray it in a different light.
Now, I've been doing medical school admissions consulting for close to 10 years, and just about everyone I know that went to DO school, not just the clients and customers I work with, but also friends and colleagues, they all primarily chose DO because it was easier to get acceptance. The majority of DOs don't use their osteopathic training in their practice either. According to a 2021 article from the Journal of Osteopathic Medicine, 78% reported using OMT on less than 5% of their patients, while 57% reported not using OMT on any of their patients. The reality is that there are many advantages to becoming an MD, with many disadvantages to becoming a DO. As such, I would argue that the competitiveness likely played a major factor in most DOs' decision, and many probably would have gone the MD route if they had been given the option. But why?
That's exactly what I just said.
Why is that wrong? Although it's true that MD matriculants generally have higher GPA and MCAT scores than DO matriculants, your title has little to do with your abilities, merit, or skills as a physician. There are good DOs and bad MDs, just as there are bad DOs and good MDs. One's merit as a physician has much more to do with their abilities as an individual than the letters behind their name. And I think we're going to see the difference between MDs and DOs become even less significant over the years. We are already seeing that transition happen today with the merging of the residency programs. But that being said, as it stands today, there are more opportunities available to MD students than there are for DO students. You have to consider the potential long-term consequences of choosing a DO school now because it's easier to get in, and weigh it against the limitations of specialty choice later down the road. For this reason, I would argue that for most students, they'd be better off choosing an MD program versus a DO program if they do have that option. This stance might be controversial. However, to say that DO students have the same opportunity as MD students right now is dishonest and is harmful to pre-meds. But what do you guys think about the whole MD versus DO debate? Do you agree with me? Disagree? Let me know with a comment down below. Thank you all so much for watching. If you enjoyed this video, be sure to check out my Why Every Specialty Seems Competitive.
All right, so I'm going to go down here. I'll give him a like. But this is my reaction. I mean, I like that he kind of swung around and said, you know, that the gap is closing and it's going to continue to close, but he is completely right, to a point. So if you want to go into a competitive specialty, you know from your senior year of high school, I want to be a plastic surgeon. Yeah, it would be very naive of you to think that you're going to do so easily from a DO school. To say that you have the same opportunities as an MD student when you're a DO student, it is a naive statement and you shouldn't think that way. But as a DO student now, knowing that I didn't have what it took to get into an MD school, I am now working my butt off to try and get to where I want to be, just because I know that I have to be that much more competitive coming from this background. So I enjoyed his perspective. He is an MD, so there's that, but he, as he said, has been advising people for years and going both routes. So I enjoyed his take on things, and we'll see where things go in the next 3 to 4 years before I make that jump into residency. If you're new here, I would love it if you subscribed, like the video, share it with your friends if you're a pre-med and looking at going to a DO school. I have a lot of insight into that. That's about all I got, so we'll catch you in the next one.